Again, Silishas are very, very hesitant in speaking in public, talking in public. Even though if they just start talking, they are very, very capable of talking. So there is mind, timidity, appearing in public, capable of talking. There are only 3 drugs: Silesia, Lycopodium, Gelsemium. So the parents or the child will tell that before going on the stage or before appearing in public, he's very, very hesitant and he really needs to be motivated. But when he does that, he comes out in flying colors. 3 drugs are there in that: Silesia, Lyco, and Gelsemium. So in the past, like now it is almost 2.5 sessions. Many things have been told about observation, about how observation should be done, what are the steps for case taking, how important observation is, not only in your case taking, but in day-to-day activity. So let us have a group activity for all the listeners, especially enthusiastic students who are listening, or enthusiastic, learners, because learning never stops for us. So there is this first activity. This you can do. I think my contact number and my mail ID is given with the link. So you can either mail me or you can either do it on your own. If you were interested, you can mail it to me or WhatsApp it to me. My number is also there. So in your repertory, in Kent's repertory, just enlist at least 10 rubrics which indicate human behavior and its expressions. Any 10 rubrics where you will see that this particular rubric is expressing the human behavior or any kind of expression. Then from synoptic key of the materia medica, enlist at least 10 rubrics indicating clinical signs of a disease. Any clinical sign: clubbing, cyanosis, discoloration, whatever. That you can do by synoptic key, that you can use Boger's materia medica, you can use Boric materia medica. And again, you can take 10 rubrics of pathological general symptoms of a disease using BBCR. If you will do this rubric hunting under these specific headings, you will understand what kind of things you need to look for, what kind of observations you're looking for. That is very, very important. If we regular basis pay, if we come across a repertory, we read a repertory again and again, we will come to know what kind of rubrics are mentioned and what are the things which we really need to look after. Second group activity is a problem-based learning. I'll narrate a case to you. Work on that case. A boy, 16 years old, Christian by religion, was a student doing his intermediate, right? 16 years boy. We came with the chief complaint of breathlessness leading to cough since past 10 years. So it's not a chronic case. It's not an acute case. It's a chronic case. Breathlessness, which caused cough, and this was happening in this boy since last 10 years. So location, sensation, modality, concomitant, things have been made easy for you. So the respiratory system was affected since last 10 years on and off. Sudden acute, then gradually it used to progress, and then he used to suppress it with the help of allopathic treatment, which gave him temporary relief. Watery expectoration, which was profuse. There was breathlessness, which was leading to cough, 4 to 5 attacks in a month for about an hour, which was associated with the wheezing. His complaints were aggravated after eating, aggravated in the night, aggravated by change of weather, cold items intake. He was always better by taking medications. And again, he was aggravated by dust also. Nothing concomitant was observed. You can make a note of it because it is an activity for you. History of chief complaint. The patient presented with the complaint of breathlessness leading to cough since last 10 years. Breathlessness used to last for about 2 to 3 minutes, and he used to get nearly 4 to 5 attacks in a month with the watery expectoration and wheezing. Breathlessness is more usually in the night when there is change of weather, dust exposure, during intake of cold items, and is better by allopathic medicines. Nothing very specific past medical history we got. The past treatment, patient took allopathic medication for the same complaint. In family history, the grandmother suffered from hypertension. And in allergic history, this patient was specifically allergic to dust. In personal history, he was a non-vegetarian. Craving was there for spicy food items. Aversion for bitter food items. Nothing very specific about the bowel habits or perspiration or sleep. Everything was okay. Nothing very specific for us. Thermals, he liked summers. He didn't use fan and blanket. Doesn't like open air. Takes bath with warm water. So he is going more towards whatever you can now decide on your own because it is an activity. On GPE, he was a stocky built person, dry skin. No pallor, no cyanosis, icterus, clubbing, lymphadenopathy, nothing was seen. He was afebrile, pulse BP was okay. Local examination. Wheeze was heard on the right supramammary region. Cardiovascular, no murmurs. The life space investigation. The patient hails from a middle socioeconomic status family. Father was a businessman, mother was a school teacher. The relationship between his father and mother was not good. Always fighting. And then when he was about 4 years, they got divorced. And after that, he became very, very sad and very gloomy. His mother was also very sad and depressed after their divorce. Husband was irresponsible, so they decided to get separated. This was the time, as per the boy, that he started with respiratory problems. He told, after my parents got divorced, I started developing these respiratory problems. After all this, after all this phase in his family, he stopped mingling much with others, but was close to some friends, selective friends. He said as days passed on, he stopped thinking about the past events and was happy with his friend and his small family. Once his mother decided to remarry, she asked him, she wanted to take his permission. And he said, like, it's your life. You can get married. He felt that since so many years, my mother was suffering. At least now let her have a better life. And she needs some happiness in life. But the relationship with his stepfather again was not good. Mother got married. There was this entry of stepfather in his life. But again, his relation with him was also not very, very good. Patient says that as a person, the father was good, but he could not accept him as a father and kept a very superficial relationship with his father, stepfather. Then his mother delivers a baby boy after the second marriage. His relation with sibling is good and he loves his brother very much. But he also had a feeling that the love shown by his stepfather to his brother was never shown to him. Like the way he used to love his own child, he never used to love our patient the way. So he felt bad about that. He also felt that the relationship between his mother and stepfather is also not very, very good. Again, the same way as she used to have fights with his biological father, same fights started after the second marriage also. So he feels that, what if, then he started having these fears. What if again, my mother gets divorced? Then he thinks that I don't want my brother to suffer the way he suffered, I suffered. He should not suffer. But then the patient says that he respects his mother a lot. And she has gone through so much of pain and struggle in life. But she never showed it to him. She might be worrying about him. He feels sorry for his mother. He mingles with his friends, selective friends. Even though they are having bad habits, he never crossed limits and did not learn any bad habit from them, means his friends. If they fought, he could not see it. Somehow he used to resolve the fight. So whenever his friends were fighting, he used to resolve the fight and see to it that they don't fight. He used to avoid such kind of arguments between his friends. Even though friends were into some kind of malpractices, bad habits, but this boy never crossed his limits. So I think after listening to this life space of this 16 years old boy, you are able to understand him as a person in a little clearer way. So patient as a person, he has a feeling of loneliness and very sad about what has happened in his life. He feels, why me? Why have I to suffer? Before he used to be alone during his childhood. Now he mingles with people, seeks for company, cannot see anyone fighting. He gets angry, but keeps it for himself. Doesn't want to share his feelings and sadness to others. During case taking, the patient cried while narrating about his family issue. So let us know the diagnosis, the general management of this boy, specific homeopathic management with totality of symptoms, provisional remedy, differential remedy, prescription. This is the activity for the listeners. And by giving you this activity, I would conclude this 3 long hours session of mine by paying my humble gratitude to the platform of International Forum for Promoting Homeopathy. I am really grateful for IFPH to spread homeopathy globally with such dedication, with such consistency. Thank you, IFPH.
Yes, thank you, Dr. BAINU Sharma.
Sir, wait, sir. Then I would like to thank all my listeners, my audiences, who have shown keen interest to listen to this session of observation. I really need to thank the chairman of scientific committee of IFPH, Dr. M.K. Sahani, sir. I am very grateful to sir for giving me this platform. Thank you, sir. Thank you very, very much. I cannot forget my mentor, my guide, my professional guru, the director, Jim's Healthcare, director of my institution, Dr. Naveen Pavaskar sir, who actually gave me this opportunity to take part in IFPH. Thank you, Dr. Naveen Pavaskar. I'm really, really grateful to you for always believing in me. Thank you to my moderators. 3 moderators I've come across. Today, I really thank Dr. Manoj. I'm really thankful to all the moderators. They were very, very supportive. And of course, my HOD of my department, Dr. Samar Chatterjee, and my enthusiastic PG scholars, I'm really thankful to them. They've always worked with me as a team. So working becomes interesting. Working becomes very, very, learning with such enthusiastic PG scholars. And my area of work, a place where I work, my workplace, my hospital. I'm grateful to my hospital from where I'm able to serve humanity and take care of patients who are interested to take homeopathic treatment. By this, I conclude, and I'm really, really grateful. Thank you. Good night, everybody.
Yes, thank you, Dr. BAINU. Nice presentation and it's professional too. And we all must remember that not only the case taking is based upon observation, but also the drug proving is totally based upon observation. No difference between these two aspects. Both are needed much patience, wisdom, and courage. As well as we should not only observe, but also there is to correct inference is needed. Then also we should know the philosophy, where to look, what are the important points. Otherwise we can't observe where to look, what to look, how to look. All these are important because this is an artistic art, moreover art. That's an important thing. A nice presentation as a teacher, you did a wonderful job, especially the case presentation, the Pulsatla child, the Silesia child, and the Varietal, all these things. Definitely, this kind of exposure is what is needed to our beloved children, our future physicians. Unfortunately, we don't have time for discussion. May I invite Dr. Ram Bhavesh Shah, one of the senior most physician and regular participant of this platform, IFPH. Sir, your comments as well as vote of thanks, please.
Oh. Thank you, Dr. Manoj ji, and congratulations, Dr. BAINU Sharma.
Thank you, sir.
Madam, very nice presentation. Good presentation. This subjective and objective symptom. Subjective symptom, very important symptom according to law of homeopathic science. An objective symptom, a kind of body mirror. So very, very thanks, Dr. BAINU Sharma ji.
Thank you,
और
sir.
हमारे डॉक्टर हुबर्ट डिसेल्वा जी, डॉक्टर पी शैला जी, thank you, and IFPH whole team, very, very thanks. Again, presentation, thank you.
Thank you, sir.
Okay.
Thank you. Good night, everybody.
Yes, with that, let me conclude today's edition. I think Dr. Hariharan has raised the hand in the last minute. Sir, please. Sit. Dr. Hariharan, sir, please. Yes, sir, please unmute. Sir, you can unmute now.
Okay, okay.
Yeah.
Hello, doctor. Really, I am very late. It is a loss for me. But anyway, very nice case taking. And very nice. See, you what about you said about pulsatilla, barita, carbon, silesia. Very, very good. Very, very good. I'm really appreciating you.
Thank you, sir. Thank you.
Good.
Thank you.
Yes.
Come again.
Yes, always such appreciations are needed to promote the growth. That is the international forum for promoting homeopathy. Okay. With that remark, let me conclude today's edition. We'll be back again tomorrow. Till then, goodbye. And
Goodbye. Good night, sir.
Time to
Good night,
conclude
good night, good
session
night.
and have to go to the Malayalam session. Thank you.
Thank you, sir.
Right.